Hi, Dr. Henry. First, can you clarify, because some of the people in the newsroom, like myself, who got AstraZeneca are a little bit confused. Will I get contacted by my pharmacy but also get an invite to book at a clinic for Pfizer? How's that going to work? And are you going to make any sort of recommendation? Because I think a lot of people feel unsure about what to do, and we're looking to you for advice on which vaccine to take.
Yeah, so you know what? A couple of things. Yes, you can make the choice. So your pharmacy will call you, and if you have decided that you want to take an mRNA vaccine, you can just let them know. If you want to take the mRNA vaccine, then you book it through the Get Vaccinated website or the IMSBC website. So yes, you will receive some information starting later today about the details of that, and everybody who received AstraZeneca will need to make that choice. There are some people who also received AstraZeneca through their workplaces, and the health authorities are connecting with your workplace and with to provide you with the information that you need as well. So it's a challenging question, and I've been asked that by my family members who received AstraZeneca. And what is becoming clear is that the risk of the rare risk of blood clots is considerably less for dose 2. Secondly, we know that the vaccine effectiveness, the real-world effectiveness of how well the vaccine works to protect you, is just as good with AstraZeneca as with a Pfizer vaccine. So there's no there's nothing there that would say you should have one or the other. The other part is about side effects. We know that the study, particularly the one in the UK, where they looked at Pfizer, AstraZeneca, Pfizer, AstraZeneca, so the mix and match, the true different vaccines, they found that if you had a different vaccine for your second dose, you were more likely to have side effects that included a sore arm and a fever and achiness and feeling kind of blah for a couple of days. None of the serious side effects, but more likely to have a bit more of a side effect. The other thing that we don't yet know, but there is some limited information that says that AstraZeneca, the way the vaccine, the viral vector vaccine, creates a slightly stronger cell response, so that those memory cells that your body needs for a longer term protection against the virus. And it may be that provides some advantage for people who had at least one dose of AstraZeneca. The only thing I can say is we call it non-inferiority. We know that it's just as good to get a second dose of AstraZeneca or to get a second dose of an mRNA vaccine after having the first dose of AstraZeneca. So it is a little bit about your own personal risk. I think it is, our basic principles of vaccines is that you should get the second dose with the same vaccine that you had your first dose, and that's what I would be most comfortable with. But for some people, that very rare risk of blood clots is a very concerning thing, and they would rather have a different vaccine. So it is a personal choice. Both of these are equally good options.